Gradowski of We Are Change.org. I'm here at a very emotional scene where two New York City police officers were murdered here in Brooklyn, New York. I am joined by Reverend S. Jordan. Now, Reverend S. Jordan is doing amazing work in the community here, and I wanted to hear her perspective on what happened here and her point of view. Can you give us a point of view of the situation that happened here?
Well, what has happened here is, should I hold
I
it?
got it.
What has happened here is really a very sad day. I'm upset about life being lost, whether it's a kid in the street or whether it's the officers that have lost their lives here. I'm very upset about this, and I feel that this is a challenge that we have got to overcome.
Can you tell us about some of the work that you've been doing in the community here and introduce yourself more?
Yes, because I am upset about the handgun violence, whether it is the police that are shooting a kid or whether it's what has taken place here, the officers, falling victim of handgun violence while they're doing their jobs. I'm very upset about this. And as a regional police chaplain and police clergy, I feel that it's my position as human to say that I can't stand for this. I'm not okay with this. This is upsetting to me. And so what I have done, going on about 5 years now, the Friends Healing Network for Healthy Living Ministries, which is an organization that I am executive director of, we have been going out into the community as a community action against handgun violence to speak to the children about handgun violence, to create programs and events to help the children have a sense of normalization, to be able to run and play without worrying about stray bullets, to create a safe environment and space for the children, because this is not normal. So whether they're seeing this on TV or whether they're witnessing another kid who gets gunned down by another kid and lays in the street for 4 to 6 hours, it's not normal. It is not normal when they hear about Garner saying that he can't breathe 11 times. It's not normal, and we're upset about this. I'm upset about this as a black woman. I am upset about this as a minister. I am upset about this as a police clergy, a police chaplain. I'm upset about this handgun violence. This is upsetting to me, okay? And I know it's not normal. And I know that the children are witnessing this from the windows, and they're hearing us talk about this, and they're hearing us talk about the hate, and they're hearing us, well, not myself, but they're hearing others talk very poorly about the police, undermining the police. So they don't know how to develop a relationship with the police because they're not taught how to develop a relationship with the police.
It seems like a lot of this situation could be done socially with community work, not just politically, but it seems like you're actually going after that social work, that community outreach. What is your pulse on the situation? Because it seems like it's been escalating, the situation between people all over the United States and authority figures. What is your take on the situation?
Well, I feel that you're absolutely correct by what you're saying, that it has been escalating, and it has escalated to a point where we have got to come to the table, we have got to talk about it, we've been fighting about it, and now we have got to talk about this. We have got to talk about being in the community, living in the community, the police coming into the community, excuse me, the police coming into the community to police the community. We have got to talk about this. We have got to find a harmonious space where we can heal. This is going on too long now, and it's time. And I am open to talk with anybody who wants to talk about how we can be more peaceful and more loving in our community.
And just so people know, you also have a Meals on Heels program, also a nutritional program, and also a youth program that helps people who supposedly have learning disabilities. And you also do a lot of community work. Can you give us a taste of what you do in the community here?
Yes. I saw that in certain communities we had more health disparities than other communities. So this was very plain for me to see that this was due to the foods that we were eating, the belief systems, because some people still believe that what you eat does not impact the brain, okay? And so what I also saw was that certain children were having more challenges with learning and in school and focus and things like that. So I began to teach and help parents understand that what they were feeding their children were definitely affecting them on that level. When they went to school, they had issues. The Meals on Hills, we're taking healthy meals to shut-ins because we want them to be here for 180 years. We need them. So this is something that we do. We are not funded, but we will find the funds from wherever we can. We take this healthy food into the seniors, and if we can keep them healthy, we can keep them out of the hospital. We can kind of like cut down on hip fractures and things like that by getting them the foods that they need.
It seems like there's many facets to the problems that we're facing, whether it's nutrition, whether it's education, and it seems kind of like a systemic problem. It's very interesting to see people on the ground trying to fix it within their community. Can you go into more into the realm of the educational outreach that you do as well?
Yes.
I think that's very important, and I think that's also a major problem that's not being addressed by people.
That is absolutely important. Our Young Scholars Developmental Network was created to work together with the young mother, with her child, and the educational system, because what we saw was that there was a gap between the parent and the educational system, and the child was falling somewhere in between, because whenever the child would do certain things, the teacher didn't really understand why Jeremy came into school and he's anxious. Maybe it was his diet. Maybe it was the lollipops and the sweet drinks that he had for breakfast that morning. Maybe it was the news that he watched when he heard about the kid that was shot down. Maybe Jeremy is worried and anxious about him being shot down. So what I saw was that the parents, the teacher, and the child, there were issues. There was a disconnection, okay? And, and so let's just say that the child gets the classification as being special needs now because he won't sit down, okay? Or he's doing things differently. Maybe he doesn't do the math the way that they want him to do it. Maybe he's doing it a little bit different. Or maybe he's not grasping it. Maybe he has some challenges in his household. So the Young Scholars Developmental Network worked together with the parents. We resource for the family. If we have to go into the educational institution and work together for the best for that child, we are prepared to do that. And what we're seeing right now is that the numbers are falling down. When we started the program a year ago, the Young Scholars Developmental Network, we had quite a few children that were coming forward, and the parents were saying that these children just, they wouldn't listen. They're not cooperating. The school had challenges with these kids. So as we worked together with the parents, what we saw was that the school, the institution, is working more with the child. Maybe it's going to take more than October, because I think around school starts in September, but by November they start to classify the children. That's only 8 weeks.
Yeah.
Who can show themselves in 8 weeks?
Yeah, and then they just give them medication and psychotropics.
So before long, they want to put the child on these drugs, or they're doing this classification. One little boy told me at our annual community holiday party, which was on Friday here in Bedford-Stuyvesant, he said that he wasn't smart, and that, he was stupid. He had all these negative things. Now, who filled his head with this? Okay? Who told him that he was less than perfect? Who told him that he wasn't smart? Okay? And of course we dispelled that. We said to him, of course you're smart, okay? So, all of this is very important. And surely as that is told to a child, we can tell a child, hate the cops, those pigs, this and that. So all of this stuff, I don't know if I'm wrong for adding this, but that is also a taught behavior, okay? So that's the issue, and that's part of why I'm here today.
It seems like there's a lot of systemic problems that lead to a lot of dysfunctional acts by other human beings, and a lot of violence is spurred by a lot of dysfunction from early on. So I think the problem is definitely multifaceted. There's so many contributing factors, but it's amazing to see someone in the community try to fix it within themselves with outreach, with real one-on-one work, and it's beautiful to see. Where can people find out more about you, more about your work, your organization, and how can they help?
Well, they can go to the Friends Healing Network for Healthy Living Ministries. They can also make contact. Should I leave a number? 347-424-2518. We love everybody. We want to talk to everybody. We want to work together on the community level. We have a lot of things we need to fix in the community, and we're ordinary people coming together to make change in the community. That's who we are.
Thank you so much, Reverend. Really appreciate your time
It was my delight.
during these dark times. It's amazing to see people stand together, come together, and try to fix all the problems that we are facing together.